Lincoln Child Center was created in 1883 as an orphanage. Today, Lincoln exists to end the cycle of poverty, community violence, and mental health problems faced by children and families in the Bay Area. Through our 12 programs, we aim to intervene in this cycle and help youth and families by providing a team to support them. We provide these services for children who have endured significant traumas, which may include physical or sexual abuse, prenatal exposure to drugs and alcohol, domestic violence, or family instability resulting from extreme poverty. Our programs are designed to help these young people transition back into school and family settings. Lincoln is improving the chances that children in the Bay Area have to lead healthy and fulfilling lives. Our biggest challenge is funding. To change the future for children exposed to violence and poverty, we must constantly innovate, finding ways to impact the root causes of poverty and mental health issues. We need private funding to be successful in transforming neighborhoods and schools. Short-term, we assist children in developing coping skills, reducing behavior problems, and staying in school. Long-term, we want safe and healthy neighborhoods and strong, stable families. We can't make this happen without donors committed to our mission. It's simple. Lincoln engages with families. They're part of the team. We're exceptional at developing a team for each young person, all of whom are absolutely committed to his or her success. In one program, we're reducing truancy by removing barriers that families face to getting their children to school regularly. This investment also helps the schools get needed revenue. We're improving educational outcomes, reducing crime, and helping public schools increase revenues. Our CEO Youth program is getting youth back to school by placing them in paid internships. They learn from entrepreneurs what it takes to build a business. We have a commitment to excellence with respect, courage, diversity, compassion, and integrity. The drive to consistently evaluate our impact makes Lincoln highly effective. Our theory of change includes 4 components: a holistic approach, focusing on healing through relationship, providing a continuum of services, and ensuring that they are integrated into communities. We enter with respect for what's already there, helping to build up rather than break down, and filling the service gaps that improve a whole school climate or a neighborhood's safety. We also attract extraordinary staff. Lincoln was selected one of the Bay Area's top workplaces in 2013. Each of our programs has specific indicators of quality and success that we track throughout the year. We also track employee satisfaction and benchmark many of our quality measures against other organizations locally and nationally. A few examples include a 70% increase in attendance within 3 months in our truancy program. Our wraparound program with foster youth has a 90% success rate of youth remaining with family even 6 months after Lincoln's support is gone. Each year, our leadership team reviews feedback from employees and families, and we develop an action plan to respond to concerns or suggestions. Many people continue to see Lincoln as a residential and special education program that serves children who've been taken away from their families. But in fact, we're just the opposite. Lincoln is absolutely committed to helping families stay together. The breadth and depth of our services throughout Alameda and Contra Costa counties has significantly expanded, and we're serving more than 30 schools. Lincoln is often seen as a traditional mental health organization. We prefer to be seen as a family strengthening organization, focusing on doing whatever it takes to develop a lifelong support team for youth. We have a 95% or above satisfaction rating by youth and families in all of our programs. Each year, our kinship program measures how many children are able to stay with their relatives as a result of getting the supports that Lincoln provides. In 2013, we helped 100% of the families we serve stay together. One caregiver told us she felt isolated. She really didn't know until she found kinship how many people were in her same situation and how much support there was out there. It's been our willingness to respond to children's needs and our ability to adapt that have enabled us to survive for over a century. That sometimes means difficult decisions, and not everyone accepts change easily. The huge philosophical shift from residential care to community-based services was a challenge on multiple fronts. We had to downsize the organization, and we made the decision to leave a property we had occupied for 84 years. We felt we had to put our money where our mouth was. If we were to live by our value of integrity, as well as a commitment to diversity and compassion for those we serve. We want to see every child in Oakland come to and stay in school, and we're creating an initiative in West Oakland to make that happen. To do this, we must reduce truancy, ensure that families have support in getting school clothes, harness tutoring resources for children who are struggling academically, and provide mental health services in schools to reduce behavior problems. Our schools need family resource centers. We also need a database to track these children and the staff to evaluate how we're doing. Many families who need our help don't have access to services through current funding streams. The working poor can't access Medicaid, which funds many of our programs. We want to impact whole communities, but can't through our current funding. Also, it's critical that young people have the educational tools and job training experiences that help them create their own future. We need additional funding to purchase materials and equipment, and to hire staff to develop internship opportunities for teens. Filling these gaps will result in students staying in school and learning the skills they need to be successful.